Okay, so this is my patient Sandy. She has a right knee that had a lot of arthritis, osteoarthritis, and she had a lot of therapies in the past that didn't help her much. She came to see us and got stem cell therapy. So Sandy, tell us about your experience. What was the pain like? What did you do? What was it like after you got stem cell therapy?
Well, the pain was getting so bad that I had to stop playing pickleball, which I love, and then it got so bad that it was waking me up every time I turned over at night. And with a Fitbit, I was able to monitor that the night before I came to Dr. Hansen, I had awakened 22 times. I counted them. And then I came in and got the stem cell, and the next night I slept through the night. And it's been that way for about a month. I'm been about 5 weeks in, and the knee is feeling much better. And just being able to sleep through the night is a real godsend. I really appreciate it.
Now you had cortisone injections and hyaluronic acid injections.
Yes.
Those really didn't do anything, did
Right. And my next step was to get a knee replacement, but I really, really didn't want to do that. So when I heard about stem cells, I thought, well, give it a try, and if it doesn't work, then I'm headed towards the surgeon.
Yeah.
So it looks to me now, we'll see, I'm 5 weeks in, but I think I've avoided the surgeon, so thank you, Dr. Hansen.
You're so welcome. Those stem cells, what they do is actually decrease the inflammation right away. So that's the thing you notice immediately.
Right.
Powerful anti-inflammatory effect. So that gets rid of the pain quickly, so you can start to sleep, so you can then start to heal. Then the stem cells will work for 3 to 12 months as building new cells, regenerating tissues, supplementing and restoring. So we'll just continue to see good things.
I hope so, because I can feel my muscles atrophying, and I really want to get back out walking and getting some exercise.
Well, now we can do that.
Yay!
All right, thanks so much.
You're welcome.